Herkese tekrar hoş geldiniz diyorum. Konu başlığı çok hoşuma gitti. Veteriner hekimlikte apiterapi. Ama tabii ki bizim için kullanım kadar kullanım şartları da önemli. Bir defa biz apiterapide dikkat etmemiz gereken sağlıklı arılardan elde etmemiz gerekiyor ve sağlıklı bir şekilde elde etmemiz gerekiyor. Biz basamak basamak ele alırsak apiterapide kullanım alanı olarak detoksifiye yani toksinlerden arındırılmış herhangi bir katkı maddesi içermediği gibi özellikle de son yıllarda saklama koşulları yani elde etmek değil saklama koşullarımızın da uygun olması gerekiyor. Kesinlikle yan etkiler konusunda minimum ya da yok denecek kadar daha önceden test edilmesi ve içerik tayinlerinin çok iyi bilinmesi gerekiyor ki son yıllarda özellikle apiterapi ürünlerinde şunu görüyoruz. Aktardan ya da hani herhangi birinden almak değil de içindeki fenolik, flavonoidler ya da ne amaçla kullanacağımızı bilmemiz gerekiyor. Uygulama dozu ya da miktarının aslında benim düşüncem bireysel olduğu, bu yüzden de hekim ya da profesyoneller tarafından yapılması gerektiğine inanıyorum. Özellikle son yıllarda biz apiterapi konusunda veteriner hekimlikte köpeklerde bel hastalığı ki bu yüz felci, artrit vakalarında pulmoner ödem, ürtikerlerde çok arı zehirini kullanmaya başladık. Yine propolis, antibakteriyel ve antimikotik etkilerini biliyoruz ama belki size ilginç gelecektir. Son yıllarda leishmanioz vakalarında çok ki zoonoz ve hastalık olduğu için ve bir aşı ya da radikal bir tedavide zorlandığımız için son derece umut verici. Özellikle de biz balı şu anda Bursa Uludağ Üniversitesi Veteriner Fakültesi'nde kullanıyoruz. Yavaş yavaş yarasa atımlarında, açık ensizyon yaralarında. Tabii ki dediğim gibi gerekli dezenfeksiyon, hijyen ya da steril ortamlara uyarak hazırlanarak kullanılması gerekiyor. Ve en son şunu söyleyebilirim. Polende de ben çok dikkatimi çekti ki sanırım Banu Hoca'nın da ona benzer bir şey var. Özellikle biz tavukçuluk sanayinde günlük 1,5 gramlık bir diyetin immün modülasyon olarak tavukları yani kanatlıyı çok daha iyi duruma getirdiğini gördük. Bu yüzden ben bu oturumun son derece verimli olacağına inanıyorum. Çünkü son yıllarda yapılan çalışmalardan geçen yüzyılda başlayan veteriner hekimlikle ilgili çalışmaların artık uygulama safhasında tıp hekimliği kadar da yer edinmeye başladığını biz görmekteyiz. Bu bağlamda emeği geçen kongrede herkese çok teşekkür ediyorum. Zümrüt Hocam başta siz olmak üzere. Stefan'a, herkese çok teşekkür ediyorum. Bu oturumunda özellikle sürelere uyarsak daha güzel geçeceğine inanıyorum. İlk konuşmacımız Jing Fang Zhu, effects on apitherapy on TL/1, TL/2, balance in rats, with types pardon, konu başlığını şurada. Type 2 collagen induced arthritis konusunda. Buyurun, sizi dinliyoruz.
Hello everyone, it's my pleasure to share some work of our team with all of you. Let me introduce myself first. I'm from the Third Affiliated Hospital of Guangzhou Medical University. My name is Zhou Yinfang. I will share the topic about effects of venom acupuncture on Th1 over Th2 balance in rats with type 2 collagen-induced arthritis. For rheumatoid arthritis, it is a kind of systemic autoimmune disease. It is the chronic inflammation or deformity of joints systemic problems. In China, its prevalence is about 0.2 to 0.37%, and it may lower the life expectancy of people. For the etiology, there are some aspects. It includes infection, genes, hormones, and autoimmunity, especially the virus and bacteria, for example, EB virus, and genotypes HLA-DR4, PTPN22, The ratio of incidence between female and male is about 3 to 1, and there is the phenomenon of disordered innate immunity. For the pathogenesis, the immune activation occurs. The immune cells play very important role, include cytokines, chemokines, and there may be the pathobiology about synovitis. The cartilage and bone may be damaged. For the immune pathogenesis, there are the steps as follows. The first, antigen-triggered responses, then T-cell differentiation and activation. B-cell subsets produce cytokines, complex cytokine networks, rheumatoid factor production, immune complexes formation, and then synovial inflammation. For Th1 over Th2 balance, the first one is RA is characterized by a marked shift towards the Th1 phenotype, and balanced regulation of Th1 over Th2 cells is a therapeutic direction for the treatment of RA. And the four aspects as follows are very important. The indexes include IFN gamma. It is a kind of pro-inflammatory cytokine. It may activate macrophages. The second one is IL-10. It is a kind of anti-inflammatory cytokine. It inhibits the production of pro-inflammatory cytokines such as IL-1 beta, IL-6, and TNF-alpha. The third one is IL-4. It is a kind of anti-inflammatory cytokine. It can down-regulate the macrophage activation and suppress Th1 generation. And the last two is T-beta and GATA3. The differentiation of Th1 and Th2 effector cells require two specific transcription factors. They are T-beta and GATA3. As for bee venom acupuncture, as we all know, the components include peptide melittin, enzymes such as PLA2, and it has the effect of anti-inflammation. In the clinic, we often use it to treat RA, and it can ameliorate the microcirculation, and it has the stimulation at acupuncture point, and then can enhance HPA axis function. For the hypothesis of our experiment, we just want to find the mechanism of BVA in RA treatment, and we focused on Th1 over Th2 balance, and we hope BVA can ameliorate RA via the regulation of Th1 over Th2 balance. For the design of this experiment, we use SD rats first to make the CIA models, and then use different kinds of treatment. They are normal group, model group, BVA group, methotrexate group, etanercept group, and then we evaluate some indexes, including arthritis index, histopathologic examination, T-beta, GATA3 mRNA, and IFN gamma, IL-10, IL-4. For the treatment of different groups, the first one is normal group. We did no treatment. And the second one is model group. Just use normal saline once a week. For the VA group, we use bee venom acupuncture once a week. For the MTX group, we use methotrexate, and the dose is about 2.5 mg per kg mg per week. For the ETA group, we use etanercept. The dose is about 6 mg per kg per week. This is the joint condition after the treatments, and we can see different condition of swelling and redness of the joints of the rats. For the arthritis index, we use the method of table 1 to get the scores of different rats in different groups. And from the left side, the picture can show us the tendency of the after the treatment, and the BVA group also has the effect of decline the arthritis indexes of the rat in that group. BVA can reduce the level of iron gamma and increase the level of IL-10 and IL-4 in this experiment. And it also can downregulate T-beta mRNA expression and T-beta over GATA3 ratio in this small experiment. For the conclusion, BVA can reduce AI and ameliorate the severity of knee joint damage, and it also can ameliorate RA via regulation of T1 over T2 balance, and it lower the level of IFN gamma, increase the level of IL-10, IL-4, and downregulate T-beta mRNA expression and T-beta over GATA3 ratio. This is just a small test or experiment for our team. We are not specialized in immunology, but I think, and on the basis of the former researchers, we can use it to help us find some mechanism of bee venom, and we hope it can guide or provide some evidences for the clinic in the future. Thanks a lot. That's all.
Evet, Sayın Zunka çok teşekkür ediyorum. Eğer izin verirseniz ben oturumun sonunda tartışma ya da katkıları alacağım. O yüzden de ikinci konuşmacımız olarak Banu Hocam'ı konuşmalarını yapmak üzere davet ediyorum. Konuşma konusu Using Facilities of Propolis in Cattle Breeding. Buyurun hocam.
Hello everybody, wish you a fruitful day, and in this section I'm trying to explain our research about using facilities of propolis in cattle breeding, preventing neonatal diarrhea and promoting growth of cows. The reproductive efficiency of herd depends on livability of newborn cows. Newborn calf diarrhea is widely observed all over the world, leading to significant economic losses in the first 2-3 week periods in both dairy and beef cattle, and annually 6 million calf was born in Turkey. Average economic losses to Turkey is about 525 million euro in a year. This is a huge number. Clinical signs in newborn calf diarrhea differs the virulence of the agent and factors as well as the age, and immunological resistance of the calf plays a role. Calves are often born unprotected in an environment with many disease agents. The better growth performance of calves made it possible to utilize them as a broodstock in early age. Utilizing the young calves as broodstock will shorten the unproductive period and increase the income of farm gradually. Various methods can be used in order to reach the target of farm gradually. Reach the target weight gain and growth. Those farmers are using different energy protein rates, feed additives, and hormones for feeding cows in order to succeed this aim. Today, such methods are not accepted by consumer because of their inversely effect on human health. The farmers are seeking for natural methods in growth of promotion. Propolis is a bee product that has, antibacterial, antibiotic, antioxidant, antimicrobial, antiparasitic, and antiseptic properties on its structure. The positive effects and preventive effects of propolis on dangerous pathogenic bacteria and viral infections have been reported by several researchers. The aim of our study was to examine the effect of propolis on growth rate and to prevent the diarrhea of cows. That's why 20 Holstein cows were used as a research materials. 5 female and male cows had been used in both control and propolis groups. Cows were randomly assigned to the groups. They were allocated with their mothers and fed colostrums for the first 3 days after birth. After they housed in portable individual calf, pen and milk was given to cows 1 in a day from bucket with nipple. Cows were reared with limited milk for 5 weeks. And we used the propolis that we produced in Ege University. And all calves were weaned at the end of the 5th week. Each calf had drunk milk and ad libitum clover hay had been sustained to the cows. And propolis tincture was given to cows 2 cc using syringe with spiral pipette from the first day of birth until the end of trial. Cows in trial were weighted after birth at the 1st week, at the 3rd week, and at the end of the research at 5th week. Also body measurements, withers height, body length, sacrum height, shoulder length, chest length, sacrum length, chest depth, chest perimeter, front shin grid perimeter, leg perimeter, head length, forehead length, width and face length were recorded at the 2nd day of birth and at the end of the research. Fecal score was visually monitored daily regarding the fluidity of feces. Feces were classified as normal, soft, loose, watery, or liquid consistency. And during trial period, diarrhea events were observed in control group. Also, 1 male calf died, but it hadn't observed any diarrhea events in propolis group. Fecal score in propolis group differs significantly than control group in 2nd and 3rd week. It was observed that after weaning, the calves in propolis group remained with the score close to 1, with an indication of health in calves. The literature considers that the calf has diarrhea when fecal score is above 3. Most of the fecal score data observed throughout the experimental group and experimental group of propolis group was below 2. Confirming propolis prevent calves from diarrhea and improve live weight gain and growth, as you see in the table. During trial, total live weight and daily weight gain means were high in propolis groups than control groups in both sexes. Although propolis had significant effect on female cows for total and daily weight gain, there was no significant differences between control and propolis groups for male cows. Variance analysis results have showed that differences for birth weight at 7th to 21st day between control and propolis groups were non-significant. Significant difference was determined between 2 groups in females for weight at 35th day. In our research, higher body measurements were observed in propolis group compared with control group. Final withers height for female for propolis was higher in propolis group. Final withers height difference between 2 groups for males was found significant, but not significant for females. Besides, body length differences between two groups were found significantly only for female cows. Sacrum height, chest, and sacrum length were found higher in propolis group. Although shoulder length was found higher in propolis groups compared with control groups for females, but shoulder length in males was higher in control group. Chest perimeter both sexes was higher in control group. Chest depth was particularly higher in control group for females, higher in propolis group for males. Leg perimeter for females in control group for males in propolis group was particularly high. Propolis could be used for both preventive and treatment in neonatal calf diarrhea. Also, propolis was very effective natural product for many pathogen bacteria types. It has positive effect on growth of livestock. Besides that, cows treated with propolis have better growth performance than cows in control group. As a result of this study, it was also shown that propolis serve to rear healthy cows and also improve live weight gain and growth. In our study, very low dose, 2 cc propolis tincture has been given to cows, but even it is very low, it shows very high effect on prevention of cows from diarrhea. So it can be predicted that even using these doses of propolis, we can get good results to survive of cows. But in order to show its effect on growth exactly, different doses of propolis should be used in trials. But it is evident that propolis is a suitable natural product for ecological animal production, besides of prevention some diseases caused big economic loss. I would like to thank all of our research team for their efforts, and also thank you very much for your attention.
Pardon. Çok teşekkür ederim Sayın Hocam.
Ben teşekkür ederim.
Sorular gelmeye başladı. Ama en sonda aslında benim de bir sorum olacak. Evet, son konuşmacımız Maria Alejandro Lopez. Bu konuda da bizde complex pathologies in animals approach to interactive veterinary medicine with emphasis on scientific apitherapy and traditional Chinese medicine. Buyurun, siz dinliyoruz.
Thank you very much. You will put the video. I'm so happy to be here in the. Hello, nice to meet you. I'm so happy to be here in the FIA and Apitherapy Congress. I am Alejandra Lopez. I am veterinary doctor, and I have studies in Chinese medicine and in apitherapy in people and animals. I am very happy to be here because Ali Timochin and Stefan Stangashu say to me that I have been here, and I am representing Chile, and I am member of the Apitherapy Scientific Committee of Apimondia since 2 years ago. So I will tell you about my work in the Araucanía in Chile. We are in the south of Chile, near Araucanía region. like here. And we are working, my husband in beekeeping, in some beekeeping company, and I developed the apitherapy in veterinary medicine, and we can obtain the bee products from the Andes mountain near like 130 kilometers from home, and there are Valdivian rainforest that is full of flowers. Thinking about the beekeeping and the interdependence of the apitherapy and the ecosystem, and thinking that said Humberto Maturana, a Chilean doctor that wrote the Tree of Knowledge, that we have all the life animals and the life in the planet have 3,800 millions of years, and we have interdependence, and we have a moral and ethic labor there. So I will tell you about the relation interspecies, and the reason that I studied some of my specialties in people and other in animals. If we think that we are Homo sapiens, and we have the 99% maybe of DNA similar to chimpanzee, we can think that we can do some experimental, clinical, applied treatments in different species, taking care of the special qualities of each one. So in veterinary medicine, we have a laboratory research, and we have a diversity in the applied medical components in animals that have fast physiologies. So we can work in it, and I have been 20 years doing apitherapy in animals, and about 10 years doing apitherapy in people. So what is apitherapy? The general concept, we know that the apitherapy is individual or mixed use of products from the hive of the best quality, which through specific process in concentration, doses, appropriate application routes, give an extra effects on nutrition, health, and quality of life. We can prevent or treat different pathologies, and we, in the modern and standardized apitherapy, we can integrate into clinical veterinary medicine in different protocols for different pathologies. So a great number of patients under registration of the information can demonstrate with scientific evidence the use of the beehive products in animal patients at the clinical and therapeutic hospital levels. So we can prevent or treat a lot of medical problems. What of the beehive products can be used in the medicine of animals? I can tell you that we can use all of the bee products, and for different ways of application. now I am doing the protocolization of different treatments, and it is in process. So I can tell you that I am doing the integral protocolization in different clinic cases and different species with traditional Chinese medicine and scientific apitherapy. What we need for it is a good quality and concentration, doses and frequency of time. We need to use the exactly frequency, and we need to consider the synergy of the beehive product. In the use on animals, the apitherapy have the allergic component, so it's mandatory to do different allergic tests in the different routes of application, because it is an individual response and we need to have security. So it is imperative. And we need to use quality products and have traceability from the beehive until the use direct in the patients. All of the clinic cases that I will show you have been treated in my consult here near my house. We live here with our family, and we are near a Mapuche community, so the people that work with me, like Rosita Mariqueo and Nicole, are women of the originary Mapuche people. I will present different clinic cases, and I start with the use of apitherapy in surgery, pre-intra and post-chirurgical. And this case is BB. She is a Chilean Fox Terrier of 5 years. She was polytraumatized with other dogs, and she has myiasis and sepsis, and she needs a surgery and desintoxication because she have a septical process. I use bee products for different routes. One was oral, and she take daily mixed products with propolis, honey, pollen, and royal jelly in high doses. And I use intradermal injectable apitoxin in microdoses. So I need to do a fluidotherapy in the start of the process, and I put microfiltered Ulma honey intravenous and general and local acupuncture. So this is the middle process. I need to put apitoxin in microdoses because the quality of the tegument was so bad, and she lost a lot of tegument. So each 48 hours, I change the propolis bandage. This case is a Doberman canine, Petra. She have 1 year and a half, and have a pyometra, sepsis intrauterine, and normally is obligatory the ovariohysterectomy total. So in this case, the owner requests that that do some not invasive treatment for me for being a breeder with the dog. So I did a informate consent signature with the owner, and the protocol was use of antibiotics, hormonal treatment, and acupuncture with apitoxin microdoses and apitherapy by oral. 6 months after treatment, the dog have a lot of puppies. Here I can tell you about the general neurological cases. Here, spine neurology and herniated discs. This is Juanito, a big dog of more than 30 kilos, and he have paraplegia for a spinal trauma. Here I use a mix of Chinese medicine and apitherapy, and we need to get the dog swimming and giving physiatry in the first stage. So I start again with the diagnosis of allergy of beehive products for different routes, and it starts the treatment. Oral treatment with high doses of apitherapy mixed products, and in parallel the use of intradermal acupuncture. I treat the meridian or channel involved in Chinese traditional medicine syndrome and the diagnosis. So we rehabilitate the dog. Here is the physiatric part, one of them with swimming, because the dogs need to fertilize the paravertebral and legs musculature using the 4 legs at the same time. Then other canine, French bulldog with paraplegia for trauma, medullary trauma, and it have hemivertebras, and the muscular atrophy in the dogs that have less than 10 kilograms makes less difficult the rehabilitation, but it have hemivertebras, so is a dog that depends of the therapy. And here I am putting the microdoses of apitoxin in the table doses, and is doing acupuncture in the extensive area of spinal cord, do meridian, shoe points, and REN meridian and points relate with kidney, like kidney 1, and tongue points that treat the 3 yaos. And here I am in reducing the acupuncture because the dog is better, and here I am treating the shoe points of kidney and Sanyao to strengthen the bones and joints and fluids, and injecting DO4 to stimulate the cord musculation. And the total recovery was in 10 to 12 months without corticoids and allopathic medication. Here, Negrita canine, Schnauzer canine of 3 years with paraplegia and spinal trauma is a similar clinic case. And here I use additionally the the spine surgery because she has flocus, flocus uh, um, from the intervertebral disc, and she needs additional to acupuncture, moxibustion, and then she recovered uh, the, the she could walk. Here, I will tell you about autoimmune diseases. He is Bruno, a male mixed canine that have lupus erythematoso sistemico, and I used uh, different bee products, um, and we will look the face of the dog that have a problem of despigmentation that uh, um, that have a coat decoloration in areas with less arrival of chi. It starts in truffle and finished in all the head and uh, back. Here is the same dog 4 months after the other picture, and it looks like other dog, but with 2 months of work, I I can show you that the dog have a repigmentation in the nose truffle area, in the inside of the truffle, and in the border of eyes. It is in a starting process about 2 weeks ago, so it is in treatment. Here I will show you 2 cases of cancer and tumoral process. She's Cindy, and French bulldog with acute dermatological and neurological synology, and she have face paralysis uh, in the in the left side, sorry, and absence of blink in the uh, left eye. So I need to work locally with apitoxin near the left side, in the left side of face, and stimulate the different organs that she have debilitate. Here is Cindy with an intravenous treatment of Ulmo, Chilean honey, microfiltered, and apitoxin in microdoses. After 6 months of treatment, she is stable without clinical signs. Here, the last clinic case is an aggressive breast tumor in BB, canine fox terrier, and she have mixed by a mixed therapy with apitoxin in ascending microdoses for different routes, and oral apitherapy with high doses of propolis, and I can show you the process. Here is a big tumor, an open one, and then it is very, very lower, and finally she haven't a tumor, and she is so good without other therapy. I will mention you that in 2010 I went to Australia, and I show some clinic cases in tumoral in tumors in animals, and Boris Bayer told me last year that he inspired on it, and they they did this scientific investigation in California in the use of bee venom with melittin in breast human cancer. Here the conclusions are that we can use and have a different route of treatment in animals using the interaction between apitherapy, Chinese medicine, and allopathic medicine in a lot of different animals. Here I can show you some different parts of my country, and very thanks for your attention. And we can see you in Abimondia 2023 or 2024, or when it be post this pandemic of COVID-19. Thank you very much.
Çok teşekkür ediyoruz. Özellikle çok ilginç bir sunumdu. Özellikle nörolojik vakalar bizim çok sık rastladığımız ve tümör vakalarında. İzin verirseniz bu son bölümde şöyle sorulara bakmak istiyorum. Sadece Banu Hocam size bir soru ya da katkı. Eğer diyor buzağlara süt vermeden önce propolisi karışımını verirsek ne olur? Hatta bu sorunun da devamı aslında ikinci bir soru daha var. %70'lik etanol içermesi ne gibi bir yan etki ya da herhangi bir mide sisteminde herhangi bir değişim olur mu? Bunu ben de düşünmüştüm. Çünkü alkol karışımı mı bu?
Evet, hocam teşekkür ederim. Sağ olun. Konuyu da açtığınız için. Gerçi kısaca yanıtlamaya çalışmıştım chat bölümünden. Stefan da yardımcı olmuş sağ olsun. Şimdi şöyle, biz Ege Üniversitesi'nde hazırladığımız ve etil alkol içerisine saflaştırdığımız yine propolis örneğini kullandık. Çamdan elde edilmiş bir propolis örneğiydi. Ve bunu biz sütle birlikte verdik. Çünkü tek başına propolisle muamele edilmiş bir şeyin verilmesi zaten mide ve sindirim sistemi için uygun olmayacağından sütle vermeyi tercih ettik. Burada tabii çalışmanın asıl dikkat edilmesi gereken noktalarından bir tanesini ben biraz bahsetmek ve açmak istiyorum hocam. Özellikle zootekni açısından, yani hayvancılık açısından buzağı kayıpları sizin de bileceğiniz üzere gerçekten ülke ekonomisi için dünyada da çok yaygın ama Türkiye'de gerçekten ciddi bir sorun. Dolayısıyla bunun doğal yollarla hem hayvan refahını düşünerek hem ekonomik yollarla hem de bizim artık yeşil devrim dediğimiz ve dolayısıyla canlılar üzerinde zararlı olmayacak şekilde yapabileceğimiz tedavi yöntemleri üzerine biraz da dikkat çekmek adına yapılmış bir çalışmaydı. Hem gelişmenin özellikle görülebilmesi ve aradaki farkın irdelenebilmesi, aynı zamanda propolisin bu önleyici, özellikle bu buzağı ishallerinin önlenmesi konusundaki etkisinin ortaya konması açısından ben o şekilde değerlendirilmesi gereken bir çalışma olarak sunmak istedim bunu.
Evet hocam, bence çok iyi yaptınız. Çünkü bizim şu anda büyükbaş, özellikle çiftlik hayvanlarındaki en büyük doğmasal, yani neonatal dönemden başlayan ishallerdir. Hatta bu konuda da Escherichia coli kadar Cryptosporidium ve Eimeria tek hücreli parazitler son derece hem Avrupa'da hem bizde çok yaygın. Tabii ki bu özellikle büyük işletmelerde, damızlık işletmelerde hayvanın bir dahaki yaşamını, üremesini, süt verimini ya da damızlık değerini son derece düşürüyor.
Evet.
Çok güzel bir yaklaşımdı. Çok çok teşekkür ederim.
Ben teşekkür ederim.